Dear friends, hello. Today's topic is interesting and unusual. This is the first time on my channel that it's not about adults. We always talk about men, sometimes about women, but today, and this is my personal selfish interest because I had a son and now I'm interested in everything related to fatherhood and motherhood. That's why I think there's no one better in terms of credentials and knowledge than our guest today, academician of the Russian Academy of Sciences, president of the Union of Pediatricians of Russia, Leila, son of Murom. Namazovo Baranovo, hello, thank you very much. We are very glad that you are with us today. There are a lot of questions. Do you know how I put them together? I learned my wife was pregnant when I got an ultrasound photo on WhatsApp. At first, I didn't recognize it, but once I realized, I honestly just stepped aside completely. She did everything herself. So, I have a question. When you find out you're pregnant, what should you do first?
First of all, you need to focus on doing the best you can for your future child, or children if that's the case. Accordingly, all questions about breast milk, breastfeeding, and so on are all connected to how we perceive this situation from the very beginning. Pediatricians say it's no coincidence the mother's mindset influences lactation, mammary gland size doesn't matter. The main thing is that if a woman, once she becomes pregnant, understands that she should breastfeed her baby in the future, she will definitely do it. And she will have enough milk for that.
I recall being in an elevator with my wife when our baby cried, and she said, "He's crying, and my breasts actually hurt." Lactation starts as soon as the baby cries, and you also mentioned something interesting about it, that if you start thinking that you should stop breastfeeding soon, it can just shut off like a faucet, and the milk can suddenly disappear. Toxicosis. I first saw this in movies while studying in medical school. Like when a pregnant woman throws up, and basically many people start looking for a reason. They think they're sick, and it turns out they're pregnant. Is this normal? And how can a woman even understand if it's serious? Does it go away easily? When should she see a doctor? Or is it normal to feel unwell during pregnancy?
I believe nature or God created the vomiting reflex early in pregnancy to make women aware that something is happening to them. Few people consider it, but some cranial nerves are designed for the vomiting reflex as a protective mechanism. If we eat something wrong, our body makes us expel it. Why protect ourselves? Here, this also serves a purpose to highlight that something is happening with the body. If everything goes normally, you realize this unpleasant condition yourself and it passes quickly enough. There are certain methods which have been described many times about how to eat and how to approach this, and after going through this during the first few weeks, usually a woman feels fine afterwards. It's another matter if this repeats or gets worse, then of course you need to think about it, because strong symptoms usually mean that not everything is completely fine with the baby in the womb. Again, I want to emphasize that not all intrauterine problems are expressed only by this, but where such symptoms are present, it's still better to pay attention to them. So, prolonged nausea or nausea that doesn't go away or any very strong changes in a woman's condition, of course, are primarily a signal that something is not right.
Many doctors say to just endure it, it's normal. But if you still feel something is wrong, what should you do and who should you turn to?
Advice should come from obstetricians and gynecologists, as there are clear boundaries. At what point does this stop being normal and become a pathology that requires action? As for the unborn child, of course, all our efforts are aimed at making sure that the mother and, in fact, the doctors treating her understand that they are no longer dealing with just the woman's body, but with two organisms or with the mother-child dyad. And if, for example, this woman is prescribed antibiotics, of course, they should be prescribed in such a way as to minimize harm to the unborn child, just like any other group of medications. That is why we have long advocated for pregnant women to be cared for by two specialists. On one hand, an obstetrician gynecologist, and on the other, a pediatrician.
Nutrition, of course, there are some obvious things like not smoking and not drinking alcohol, but still, the basic principles of nutrition are important. Because I've seen that many people start eating everything they want or don't want, stuffing themselves with anything, and say that now they shouldn't restrict themselves in any way. And as a result, by the end of pregnancy, they've gained 77 pounds. We'll touch on this topic later, but for now, what are the basic principles, the nutrition advice that you would give to our future moms?
Everything should be reasonable. You're right. There shouldn't be excess or deficiency. It's equally bad to justify eating excessively by saying, now I have to eat for two. That's just as bad. It's absolutely wrong to restrict yourself, especially when it comes to protein foods like vegans or sometimes even vegetarians do, without realizing that in this situation, the calculation for protein intake should be completely different. As for the first situation, well, it's pretty obvious too. There are certain limits. As a rule, considering that on average a baby is born weighing about 3 to 3.5 kilograms, a mother's weight gain of around 10, maybe a little over 10 kilograms, is considered absolutely normal. This means that she really gained just enough weight to carry the baby, along with the amniotic fluid, placenta, and so on. But she hasn't crossed that line where it becomes very difficult to get herself back in shape and, again, not harm the baby. I'll come back to this in a moment. As for the opposite situation, there is a very interesting phenomenon here. By the way, it was described a long time ago. It's called the phenomenon of the Great Dutch Hunger Winter. It was described during World War II when they observed pregnant women. Well, even during the war, there were people who were carrying children. Women in the Netherlands who experienced a severe shortage, especially of meat and dairy products, had pregnancies under such conditions, which was very difficult. And when it came time to give birth, they all delivered babies with very low birth weight, which in general is understandable. They were starving, they received little protein food, and as a result, these children were small, they were normal for their gestational age, but had very low body weight. But the most interesting thing happened later. After a short time, many of these children quickly developed excess body weight and obesity. And it became clear that when a child is deprived of protein during fetal development, after birth, they start to catch up. But they can no longer stop, so to speak, and instead they become, you could say, a person with excess body weight. So the story continued when these children grew up and had the next generation, whose children were also observed. It turned out that they were also born underweight, even though their parents' nutrition was already normal. But they also quickly became overweight and obese. So what does this mean? The experiment shows that you shouldn't go from one extreme to another, meaning that both overeating and undernourishment are equally bad. As for the general principles, well, in the first and second trimesters, you don't really need to make major adjustments to your diet. In fact, the baby inside is still so tiny at that stage that you don't need to assume they require a lot of extra food. Yes, that's true. You generally need more later in the second and early third trimester, when the baby is already big and naturally requires more resources in terms of different macronutrients. In any case, nutrition should be balanced, well thought out, and of course, this is a very important factor in programming the future child's health.
You brought up the topic of veganism and vegans. You have a lot of experience. You've surely seen such children. They always think only about themselves, and sometimes they even make their own children give up meat. And we know what this leads to. Tell me, if we look at vegans who continue to promote giving up meat even during pregnancy, who don't monitor their iron levels and don't eat animal protein, how are their children different from, let's say, people who eat everything?
This problem is, of course, multi-layered. It's very complex, and I hope people who practice veganism or vegetarianism won't be offended by me, because actually I myself am a pescatarian. I don't eat meat, but I eat fish, vegetables, and dairy.
But why be offended? You're just telling the truth.
I'm telling the truth. Sadly, families like that often have serious issues with their children. Everyone's microbiome is unique. Some people, based on their microbiome, are suited to being meat eaters, while others fit more with vegetarians. But this applies to adults and all children. Animal protein is very important, first of all, as well as many other trace elements and vitamins that are found in meat. Therefore, vegetarians to a lesser extent, but strict vegans who, even when pregnant or breastfeeding, completely exclude not only animal protein but also dairy and use various alternative forms of milk. Unfortunately, they are putting their children at great risk. I have personally seen these cases as a pediatrician, and unfortunately, many of them are very sad. There have been cases where children who were developing normally at first suddenly stopped, and the effects went as far as demyelination. The symptoms resembled those of multiple sclerosis. When the nerves were exposed, the child lost function, emotional, sensory, and especially motor skills were all affected. For example, a previously cheerful, smiling child who was beginning to sit up or stand. So in the second half of life, when motor functions are actively developing, this development would suddenly stop and the child would become very, so to speak, sad and downcast, in other words, not very emotional, and would stop moving. Treatment, but the treatment is serious. Steroids restore the myelin sheath, so these are serious effects on the body. It seems like we improve the situation a little, the child starts developing again, but if the parents don't listen to the pediatrician's advice, it happens very quickly. Unfortunately, it all leads to the same effect and can end very sadly, in the saddest way, in a very short time. That's why people who don't understand the importance of proper nutrition for children, unfortunately, are putting them at great risk and danger to their health. No one is saying that an adult can't choose the lifestyle or diet they want for themselves. But you should never try to impose this on your children. After all, in the culture of any people, no matter what restrictive measures related to religion there were, they were never strictly applied to children. For example, in the Orthodox religion, in the Christian religion, there is a time of fasting, but it was never said that children should strictly observe the fast. So to speak, they don't need to exclude everything strictly, because it's clear that a child's body requires a completely different intake, above all, different groups of nutrients, especially proteins.
This weight that sticks, the stretch marks because of it, the breasts, the figure. Psychologically, a woman starts to suffer. By the way, you mentioned excess weight. I read a study about this. Why, by the way, am I against women working? And you know, while this is happening, maybe the stress that comes from outside affects not only the woman, but also the adrenal glands, which release hormones that affect the fetus as well. The fetus, sensing the stress hormones, prepares for the fact that, look, you mentioned food, that there is little food. After all, obesity is a factor of adaptation, and stress hormones also trigger these adaptation factors. So we have the same genes, but their activity can change. People whose mothers experience stress, like malnutrition, often become overweight after birth. And of course, we doom such children to a long period of problems. The mother sees her overweight, worried self in the mirror and realizes she married a foolish husband. He tells her, "You've gained weight," while she's pregnant, so she hears from him that she's gained weight. That doesn't help emotionally, and many women find it adds extra stress. So how can you actually figure out how much weight is being gained and what causes this weight gain in the first place? When should a woman seek help if she objectively feels like she's eating as usual, but the weight just keeps piling on and piling on? Seek help if you can't control your appetite or notice you're gaining weight despite eating little. I saw a video of a woman who lost weight after getting pregnant.
Well, let's start from the very beginning. First of all, I'd like to say that we, as pediatricians, are absolutely against the word fetus, because actually only in the Slavic group of languages do we have the term intrauterine child. The fruit that hangs on a tree, like an apple or pear, has one word, but in other languages they're still called by different names. Fetus, or maybe fruta or whatever, it's just another word. That's why we still call it an unborn child, the one who will soon be born, or maybe very soon, in 9 months. So it's equally bad when the body weight is insufficient and when it's excessive. And here, first of all, I want to emphasize that those overweight women, as you say, who have given birth to children and are even breastfeeding them, in fact, their children gain on average a kilogram or even more during the first year of life compared to their peers whose mothers have a normal body weight. This is already a risk factor for future excess body weight and obesity in the child, similar to maternal undernourishment. Now, as for when to sound the alarm, actually, you should start worrying from the very beginning. All women, thank God, go to the maternity clinic, and they even get extra money for doing so. If you register at a certain time, naturally at every visit they tell you, they record your body weight and give you an approximate idea. You can check how much weight you can gain before your next visit, and if it's within the acceptable range, that's fine. No one says it must be exactly 100, 200 grams or half a kilo. Small fluctuations are expected. But if a woman is supposed to gain, say, 1 kilogram and she gains 5, then of course that's a reason to be concerned about weight loss. Yes, that's documented. That's actually normal for the first trimester because you lose a little weight since your baby is already starting to gain something from your internal reserves. By the way, I had the same thing with my second child. So it was unexpected for me. I realized that in the first 2-3 months, I actually lost weight, which made me understand that there was some excess I could easily get rid of. So you shouldn't wait for some critical moment, you shouldn't wait until your not so smart husband, as you say, starts pointing at the mirror and saying, look at what you've become.
At the same time, most of the time, they themselves are like that too.
These husbands also enjoy singing silly songs like "The hippo doesn't have a waist" or something similar. Of course, this definitely doesn't contribute to mental health at all, and it's certainly not a good background for the development of a baby in the womb. Because you were absolutely right when you said that stress experienced in the womb will make itself known throughout the rest of a person's life. That's why it's vital for a mother to be in harmony with herself and her surroundings. Again, in almost every culture, pregnant women were offered certain things, whether it was in the Caucasus or in other regions, to look at the beautiful nature around them. In some places, it was suggested to visit museums, enjoy the beauty of works of art, and listen to beautiful classical music. By the way, it's very beneficial for the future baby to hear melodic music and the mothers singing, but I want to emphasize specifically melodic music. Mozart, Vivaldi, and similar composers are preferred. Of course, you shouldn't go to heavy rock concerts or anything like that because it's clear that those deep bass sounds naturally affect the unborn baby as well.
So they've gained some weight, they start going to the gym, and probably there are some restrictions here as well. I've often seen different videos where women already have quite large bellies. They weren't just doing some stretching, but they were actually squatting with a barbell, doing pull-ups and jumping exercises. So where is the reasonable limit, and what do you think about pregnant women who do this kind of weight training? It's a trendy word.
Going back to the previous question, it's not about how long a woman will keep working. If she enjoys her job, then let her work throughout her whole pregnancy, for example, even with her older child. I never took maternity leave during residency because I was interested in everything and really enjoyed it. I literally went to work right up until the very last day because it really helped me, even just to feel better about myself, I guess. You should never limit physical activity, all those kinds of tips. Like, you should just lie down. You need to think about yourself, about your baby. Please just take it easy. Don't run around. By the way, I've actually heard advice like that from older colleagues, even at work. Like, why are you taking the stairs? You're pregnant. Take the elevator. No, it's actually very good for you. Normal physical activity benefits pregnant women, but moderation is key. I absolutely don't think that doing heavy weightlifting at this time is good for you. It's still quite a serious challenge for the body for different parts like the spine, the ligamentous system, and so on. So it's one thing if it's a woman who has been doing this for many years and at some point up to a certain stage of her pregnancy. She seemed to still be actively doing her usual physical exercises in the same way, so to speak. It's a different story when you have to earn it again, even with attempts to move forward. This is very important, and of course, a pregnant woman should read the right literature more and know, for example, which activities can stimulate something. For example, back when I started working, there were no computers, there were typewriters, and of course, we were all actively typing out records on typewriters. But at some point, I realized that actually, because this irritation of the fine motor skills of the fingers, just like playing the piano, can actually contribute to increasing the tone of the uterus. Not all women understand which activities contribute to this and which do not. It would be good if the obstetrician and our colleagues explained this more.
Since we're discussing activity, let's talk about traveling. So I have tickets. We were supposed to fly, let's say, to Japan, and suddenly there's a positive test, and the flight is in 3 weeks. In general, what about flights, and how dangerous are they? Because as we know, after flights, people can get blood clots in their legs and all sorts of things. Are there any restrictions for pregnant women, and when do they apply? Maybe you could give some advice on how to reduce the risks.
Well, again, you should follow the rule that it's better to travel, and preferably not transcontinental trips, but ideally within your own, let's say, time zone. Well, give or take within about 3 or 4 time zones.
That's actually pretty close, I think. Sometimes you have to fly for about 15 hours.
No, of course, 15 is too much, but overall it's the second trimester. In the first trimester, you really need to give the future baby a chance to settle in properly, so that external factors like pressure changes and other stressful situations related to traveling, especially abroad, for example, don't play a bad trick. And on the other hand, of course, when it's already the third trimester, you shouldn't go overboard either, so you don't end up flying and causing premature labor, because that's also risky. By the way, many airlines don't even allow you on board without the appropriate certificates and, so to speak, notifications that the pregnant woman and her relatives are aware that in case anything happens, they bear all the responsibility themselves. So, well, a reasonable approach is always a reasonable approach.
Now let's consider a bad scenario. At later stages, it's clear maybe there could be delivery or maybe something else could happen because of the flight. And at early stages, what could happen? Miscarriage could happen. And at later stages, it's just that delivery could happen earlier.
Premature birth, yes.
Could anything bad happen from this?
We as doctors theoretically understand things like blood clots. They are especially dangerous for pregnant women because we don't check D-dimer throughout pregnancy for nothing. Yes, because there can be a tendency, especially in situations like antiphospholipid syndrome and so on, but that doesn't mean it's always the case for everyone. You just need to be attentive, you need to know what your test results are, whether you have any problems or not, and only then make a decision, not after the fact. Regretting that, like, why didn't we check earlier? We should have done the test and made sure that it doesn't really suit us, but it's better to think everything through in advance and then make a decision.
I have a friend named David who says, "Your wife is driving, take the car from her, she shouldn't be driving. My wife drove until the end." And he was worried that, God forbid, there might be an accident, anything can happen anywhere. And I'm interested in your opinion about driving a car, because, for example, the airbag, it could go off. And the second one I didn't pass until Xenia, my wife, was pregnant. It turns out there's a special seatbelt, and it secures you a bit differently. It goes between your legs.
Because the belly needs to be protected in a certain way. That's right, but on the other hand, we're all under God's will. They say you can walk down the street and suddenly get hit by a falling icicle or brick. So, in general, I wouldn't go so far as to say that no one should drive at all. At least I wouldn't put it that way. Riding public transportation also has its own negative aspects and in fact can also lead to some unfavorable outcomes. If you follow all the rules properly and drive carefully, of course, as you said, with certain precautions and naturally without breaking the law, then in general, I don't see anything wrong with driving a car on your own.
Uncomfortable questions about illness in pregnancy. Sometimes everything appears fine during pregnancy. And I had a friend like that too. I visited him and he said, my wife got sick and now we're checking to see if it's that or not. They say, you need to have an abortion. He replies, but the baby's heart is beating. They insist. If you don't, there's a high risk of abnormalities. Tell me, are there any illnesses that a pregnant woman absolutely shouldn't get because it could result in the baby being born sick?
Everything that happens, especially in the first weeks of pregnancy, is very dangerous in terms of its damaging effect on the unborn baby. This can include any kind of radiation, such as undergoing certain examinations, X-rays, or other similar procedures. These can be occupational hazards, or it could be some serious therapy when a person doesn't yet know she's pregnant and continues to receive it. For example, anti-cancer treatments or other similar therapies. This is where the greatest risk may be. And of course, infectious diseases, most viral infections have a very pronounced teratogenic effect.
Which ones should we fear most? The flu?
Of course, measles and rubella. Well, I mean, it's not for nothing that they say if you're planning a pregnancy, please not only check your health, but also treat all your chronic illnesses so that what we're talking about doesn't happen. Yes, when you're getting treatment and suddenly realize you're pregnant, it's better to get treated first and then focus on the desired pregnancy. The same goes for vaccination. Protect yourself first, then start this period. There are greatly exaggerated discussions about the risks. For example, in that same book of ours that you quoted, we described in great detail which diseases are actually vaccine preventable. Even if they occur in a pregnant woman, do they require delivery? Do they require, so to speak, termination of the pregnancy, and which ones do not? Because very often obstetricians also interpret that any illness a mother experiences is a reason to terminate the pregnancy, which is not true. But let's emphasize once again, if you have been vaccinated, you have protected yourself, you have created a cocoon. Nowadays they talk about cocoon vaccination, meaning all family members have done it, then what? The risk that a pregnant woman will get sick, for example, with an infection that has a strong damaging effect on the unborn child is practically reduced to zero. When is treatment prescribed? We already talked about this with you, but let's remind our listeners once again that it's important to weigh the possible effects on the mother and the possible effects on her baby. Let's say a urinary tract infection is a fairly common situation for a pregnant woman for obvious reasons. And again, there are different possible scenarios here. It might be possible to use some fairly harmless herbal remedies with a good cleansing effect, or you could immediately go for a strong chemical medication, so to speak, a powerful antibacterial drug. Well, probably the second option isn't quite right for now. That is, you can try to use milder remedies that are safer for the child's health.
And vaccines, well, that's generally how we all feel about them. Some people say absolutely no vaccines under any circumstances, and we'll have a separate question about that as well. But what about a mother during flu season? Can she get vaccinated if she's planning to become pregnant soon, or is it better to avoid vaccines altogether if you're planning a pregnancy?
No, you can protect yourself before pregnancy, but if you didn't, it's essential to get protected while pregnant. Yes, you can, and you definitely should. It used to be considered a controversial issue, but today it has been proven that fortunately this vaccination has absolutely no negative effects on either the baby or the mother. On the contrary, it only has positive effects. Previously, vaccination was only recommended in the third trimester, but now it's given regardless of trimester. But if the family is very worried, it can be done in the second or third trimester. By the way, again, many vaccines are under special monitoring. Sometimes, for instance, a woman gets vaccinated and later discovers she's pregnant. Take the human papillomavirus vaccine, which you, as an oncologist, know well. Today, a lot of oncogenic effects are attributed to it, starting from the anogenital area, head and neck cancers, and even including various exotic ones up to bladder cancer. So, for example, the human papillomavirus vaccine belongs to category B, which is safe even during pregnancy. Because even after observing many pregnant women who received this vaccine, not one case of birth defects has been reported.
Many, as soon as they get a positive pregnancy test, stop having sex, and at first they don't have sex because they're pregnant, then because they've just given birth, and then because they're breastfeeding and don't want to. Still, you can do it like that, without specifics. Safe periods when you can have sex with a woman who is pregnant.
No, actually, all these talks about potential danger are really exaggerated here as well. Well, of course, there are different nuances. As adults, we understand that it shouldn't involve, so to speak, any exotic options and so on. But it's important to understand this. The hormone-positive pleasures that a mother will experience during this period are very important not only for her husband, but also for herself. Naturally, this also benefits the child indirectly. So to completely dismiss this point just because it's supposedly always bad is also absolutely wrong.
And being affectionate with your wife when she's pregnant is not accepted in many cultures at all. Expressing emotions, and they're so reserved, but to give an extra hug, a kiss, or a compliment, even if it's not very sincere because she's gained a lot of weight. That's the thing. The positive emotions she feels are also good for the baby.
Of course, absolutely. That's why it's so important for all family members to try to create this emotional, very favorable, comfortable kind of cocoon around the pregnant woman, because the happier this woman is, the healthier the baby inside her will be. She's a precious vessel that should be put on a pedestal in every possible way, because she truly deserves it. The better, the more comfortable, the happier a woman is naturally, the more likely it is that the programming of her unborn child's health will go absolutely right.
So we can state as a thesis that during pregnancy, if you want your child to be healthy, under no circumstances, even if your wife is wrong, should you argue with her.
Of course, you shouldn't hurt her, you shouldn't stress her out unnecessarily or make her nervous. It's clear that many people watching us now will say, yeah, try being gentle with that witch. No, of course, there are different people and situations can be different, but right now we're talking about families where people have mutually agreed to become parents. In this situation, I think you've made a completely valid point. Yes, of course, a pregnant woman should be cherished.
We have this little one in the belly, so from what age does this little one start to hear, for example, music? And you mentioned Mozart, Beethoven, all classical music. It's beneficial because the mother feels certain emotions while listening, or because the baby hears and understands something, which also affects them.
Of course, the baby already hears, understands, and it affects them. In recent decades, many of our medical ideas have undergone significant changes. You know very well that it used to be believed that all the cavities inside us were sterile, like the sinuses and so on, but today it has been proven that there is nothing sterile inside us. Just like on us, we are surrounded everywhere by our neighbors, so to speak, microbes, viruses, and all that group, whose total weight significantly exceeds the weight of our own body. So a fetus definitely feels many things. For example, it experiences the world through smells, and its sense of smell starts working in the womb through the food that the mother eats. Why do we say that a mother should never have a poor diet or go on a diet? She can't just eat the same foods, basically living on bread and water. Because then, accordingly, this sense organ will not develop in the child. Oh, and this unborn child definitely hears as well. There are numerous experiments, and now we are about to publish another article about communicating with the baby in the womb. After all, if, for example, the baby kicks from the inside, that is during the second half of pregnancy, you respond by pressing the same spot again. For example, say something and press, and the baby will kick back. Yes, there really is communication. It is established much earlier, and in this communication, singing allows you to achieve much better results because the baby really hears both the mother's voice and other music. This is also proven by the fact that, for example, children who had to listen to, let's say, Mozart or Vivaldi in the womb, when they are born and the same music is played for them, they become quiet and listen attentively. This effect does not occur if they are played other music that is unfamiliar to them. And a lot of such evidence has been obtained recently. So we should never underestimate a child's development. Because even 30 or 40 years ago, it was believed that a premature baby was not capable of feeling pain. They believed you could give injections or do anything to them and they wouldn't feel it, but that's not true. They do feel it, just differently. Unfortunately, their reactions haven't matured enough for them to express it the same way, with the same facial expressions as a full-term newborn would. And that's why it's all very significant. In recent years, these approaches have all changed.
I understood about the vaccines. I have another question then about antibiotics. We have some of the most common ones. There are three well-known barriers: the blood-brain barrier with the brain, the blood-testis barrier, for example, in men, and we also have the blood-placental barrier, for example. Antibiotics are classified by their ability to cross these barriers. So what advice would you give a pregnant woman who needs antibiotics? First of all, probably not to make decisions on your own, that's right. And second, how can you know if it's allowed or not? If it's not prohibited, or should it be specifically stated that it's allowed during pregnancy?
Here you need to pay attention to several points. First of all, why are antibiotics generally, how should I put it, extremely unfavorable? So, of course, wherever you can avoid using them, it's better not to use them. It's better to use some other options and try to avoid this exposure as much as possible. Because, as we've already mentioned several times, programming starts at least from the moment of conception and continues until the end of the second year after birth. Life, this window likely opens sooner and closes later. It is well known that taking antibiotics during this period, unfortunately, significantly altered the child's future life trajectory. This affects both physical and cognitive health. That's why every time the question of taking antibiotics comes up, you need to think 100,000 times, only after consulting with doctors and only by choosing the best option. As for these...
Let me interrupt. You mentioned cognitive. Could you clarify? So, if we take antibiotics, could it even affect the cognitive function of our child?
Including that? Yes, because it's a disruption of the microbiome. And this disruption of the microbiome leads to changes in the synthesis of many neurotransmitters, and accordingly, all the resulting consequences. That's exactly why infections are dangerous too. Why do we always try to protect the unborn and newborn child from infections? As much as possible, because everything that happens during this period up to and including 2 years old will definitely affect their future life. So what else makes the situation more complicated? After all, for this phrase to appear in the instructions recommended or safe for use, appropriate clinical trials must be conducted on pregnant women. As you can imagine, clinical trials with the youngest pediatric patients and pregnant women are the most challenging. That is, for ethical reasons, it's incredibly difficult to do. It's almost impossible to persuade a pregnant woman, for example, to take an antibiotic if it's not indicated for her. But how else can you prove that it's completely safe or that it's as safe as another drug? Placebo, a sugar pill? That's why, for almost all medications, you'll find in the instructions that safety for pregnant women hasn't been proven. And it's the same for young children. It's extremely rare to find anything specific about pregnant women precisely for these reasons. Organizing clinical trials in these populations is very difficult, so if studies aren't done, that information won't be in clinical instructions. Accordingly, choosing medications for pregnant women and young children is always a big problem, always a major challenge. Because we always have to weigh this, you see, on the scales. On one hand, we need to treat with something, but on the other hand, we might not have an officially approved medication.
But stimulants like caffeine or energy drinks are now popular with many people. What do you think about the fact that personally, I, and I think you too, associate things like energy drinks with an unhealthy lifestyle? I'm very interested in this, and that includes coffee too. But what interests me even more are e-cigarettes, vapes, and these electronic hookahs.
You have a very negative attitude. Well, as a pediatrician, I have never smoked myself, of course, and moreover, every year I become more and more convinced of how much harm all these things cause. That is, traditional harmful cigarettes were first replaced by electronic cigarettes, which turned out to be even more harmful in terms of quantity. In other words, the tar that ends up in the lungs. And then came vapes, which behind these pseudo-pleasant smells and supposed safety actually also cause a lot of damage. There are even new lung diseases described, like popcorn lung and so on, meaning changes in lung tissue under the influence of all this, so to speak. So people who think that occasionally indulging in hookah or vaping or something like that doesn't have any effect are actually mistaken. Unfortunately, we have seen children and teenagers who, after trying a vape just once, suffered very serious damage to the cerebral cortex up to decortication. It's unbelievable. Basically, it's like Russian roulette. So some people might get into it and not seem to suffer much, but someone else could try it once or twice and end up in a coma for many years. So honestly, it really depends on the parents to properly teach their children about this. Not to mention that many adults complain, "Oh, doctor, what's going on? The child is sick and we're always sick and we keep coughing for so long and everything lasts so long for us." Didn't you experiment as a teen? Didn't you smoke? Oh, I did. Well, what do you expect? You damaged your mucociliary clearance and now you're complaining that it takes you a long time to recover? I mean, everything in this world is very complicated, but also very logical. That's why you absolutely shouldn't use this nonsense. And of course, it's best to explain to children first that this might be trendy, but it's extremely dangerous for their health. As for caffeine, you're absolutely right about that too. All these energy drinks, we once did a study, we gave them out. Well, by request, it was an experiment requested by the ministry. And I think even some other agencies were interested in it too. We simply examined the cardiovascular and other functions in children after adolescence after they consumed energy drinks. You see, the heart rhythm changes, not just the heart rate increasing, but the rhythm itself changes. And you understand what a change in rhythm means. It can lead to sudden stops and so on. Naturally, this affects the central nervous system. Teens who drink lots of energy drinks struggle to sleep, spend time on gadgets at night, and then can't wake up in the morning. It's sleep inversion. This also leads to excess body weight, obesity, and definitely to a decrease in cognitive abilities. So everything related to the improper use of energy drinks and caffeine in general falls into this category. By the way, Coca-Cola falls into the same category when it comes to coffee itself. It's clear that many women, especially in the morning, often complain out of habit about weakness or low blood pressure, but in everyday life it can be easily restored by doing 20 or 50 squats. You can't always suggest this to a pregnant woman, though it's generally beneficial. In fact, 1 or 2 cups of coffee, as is usually the case of medium strength, especially in the first half of the day, haven't really harmed anyone. You shouldn't exceed this dose or overindulge in it.
I often see pregnant women getting folic acid, which indicates a problem. I would like you to tell us what important things there are that we should get from food, or if there's a deficiency, take additionally in the form of vitamins, for example, and what will happen if we don't. Let's start with folic acid. Maybe you can recommend something else as well.
Folic acid isn't necessarily a sign that something's wrong in the body. Folic acid is given to a woman to prevent the development of neural tube defects, that is, defects of the nervous system in the future baby. There's an interesting effect here, which is why we say the programming window opens before conception. Giving folic acid to a woman 6 months before a planned pregnancy is much more effective than starting it on the first day of pregnancy. And this means that we can prepare for pregnancy, for example, with the help of this vitamin. What other vitamin are we vulnerable to? Well, I mean, exactly, specifically for, let's say, the central part of Russia. Yes, actually, to be honest, this is typical for most regions of Russia. This is, of course, a deficiency of vitamin D. That is why pregnant women are always given vitamin D. Besides that, of course, there are rules. The problem with iron, honestly, according to our scientific data, exists in certain regions. Up to 60% of adolescent and older girls suffer from anemia. That means, by definition, they already don't have enough iron to carry a child well. So, what are the dangers of low iron levels? It's clear that the woman herself isn't getting enough oxygen, which means she can't provide enough oxygen to the baby in the womb either, and the baby starts to suffer. All these cases of fetal hypoxia can be caused by this as well, so it's very important to address iron levels. As for everything else, of course, you shouldn't go to extremes here. That is, on one hand, if the diet is normal, complete, and balanced, then most likely you don't really need to give anything extra. But if there are any problems, let's say people live in extreme conditions where it's very difficult to find, for example, fresh fruits and vegetables, and we all know very well what happens to any fruit or vegetable when you put it in the fridge. Well, in conditions of low temperature, so to speak, after just a few hours, there's practically nothing left. That is, anything that isn't freshly picked already has significantly fewer of all these wonderful vitamins and micronutrients. That's why probably we're talking about additional supplementation with some micronutrients or vitamins. And another important component, of course, is iodine. The thing is, for more than 30 years, we've been fighting to have only iodized salt in our stores, and for many food products, like everywhere else in the world, to contain iodine, because most regions of Russia lack iodine. Accordingly, this iodine deficiency could easily be compensated for if we always used only iodized salt in our food. But unfortunately, when we go to the store, we have to look carefully at the package to see if it contains iodine or not, and non-iodized salt can still be found in stores. Therefore, pregnant women and others receive iodine supplements.
I've seen a bandage. My wife wore one. What do you think about that?
That she wore?
What do you think about the bandage?
Well, it's a necessary thing, of course, especially at a certain stage of pregnancy. It becomes a great help. Because, of course, it also depends on the constitution and the development of the muscle corset of each person, each woman. Let's say for asthenic people, for those with connective tissue dysplasia, a bandage is absolutely essential because their own muscle corset simply can't handle such a load. The only thing here, just like everywhere else, is the rule to choose everything correctly. That is, to select the right size, to secure it where needed, and so on, so that it is neither too tight nor, on the contrary, too loose.
Many men are afraid and keep listening to see if it's moving or not. We've had moments when, for some reason, he stopped kicking. And we put it on listen with the stethoscope to see if there's life. It was scary. Yes, when he was born, we used to laugh at others, but then started using a mirror to check if he was breathing. Well, it's like paranoia, and we're always afraid of being late with things like when they put someone in for observation to help. Tell me, are there any signs besides abdominal pain that tell us something is wrong? And is it a matter of hours or days? And should you not wait, but go and get checked, get an ultrasound maybe? Are there any really alarming signs?
No, well, it's all within reason. Again, if nothing happened, like there was no trauma, no fall, or anything like that. So when we suspect something happened that needs urgent investigation, we should ensure everything is okay. So if life was normal, everything continues as usual, and the sensations are the same now in 2 hours, and so on. It's different for everyone, and strong jostling isn't good. It means that there is still some kind of hypoxia happening, so these jolts should also have a certain regularity.
Movement could indicate low iron.
It may not be iron, there could be other reasons, such as placental insufficiency or other causes. Some believe that if the baby is very active, moving and dancing, it's a good sign. Pediatricians and neonatologists know this is a reason to investigate, not ignore. That's why they use tachography and other tests. That's why if there are no discharges from the natural birth canal, well, basically no blood or anything.
But if there is blood, it means it's being discharged if that happens.
Sometimes situations differ, such as when the amniotic fluid breaks.
Suddenly, you're overestimating the knowledge level of my followers. They don't even know what pregnancy is.
Yes.
There are doctors there, but many regular people are watching too.
That's why I'm sure most people know there's amniotic fluid around the fetus, so...
Here's an important question. A puncture to send amniotic fluid for analysis. What do you think?
Well, again, it depends on the situation. If the mother is young, if there's nothing in the family history that's concerning and so on, then why go in there unnecessarily?
Many people insist it must be done. I'm worried I couldn't handle having a sick child. And now it's become a trend to prescribe it to everyone, especially to so-called very important person patients. If something is missed, a sick child could be born. And I had a case, one of my, let's say, acquaintances. They did a puncture and then it kept bleeding and bleeding, just wouldn't stop.
Everything should be done sensibly. I'll repeat, as the mother gets older, the risk of children having genetic issues rises significantly, right? If a woman has her first child at 20 and her third at 35, it's obvious at 35, she'll be told that she probably needs, for example, to check her DNA, that very DNA test. Yes, for example, Down syndrome or some other common reasons for children to be born with genetic abnormalities at an older age. Usually it's a short list. The most common situations are checked and ruled out, reassuring everyone. What you're talking about is also kind of a trend nowadays, but people need to understand that we still won't be able to look at everything, at absolutely everything. Sometimes, for example, we don't have a guarantor.
It's still possible.
Of course not. Sometimes now we encounter a child with autism spectrum disorders. Autism is much more common these days. Many are genetically determined, so it's important to know if a genetic deviation exists, since behavioral principles differ. For example, with certain genetic diseases, we expect severe epileptic seizures may occur. We need to prepare for this, inform the parents, and explain that symptoms may vary. We advise parents to get a genetic test to rule out certain diseases. They say, wait, we had tests while I was pregnant and everything was fine. Yes, they likely ruled out the most common diseases for you, but not everything. There are thousands of diseases known to humanity today, and there are more than 7,000 rare ones alone. Well, obviously, no one runs tests for 7,000 diseases, so it's a bit like that. How should I put it? Everything related to genetics. Since we've touched on this topic, let's spend a little more time on it. A lot of people misunderstand the purpose of genetic testing. Let me give you Japan as an example, the experience of Japan. Back in the early 2000s, when the topic of genotypes started to gain momentum all over the world, they were involved as well. They decided to describe the genome of every Japanese person and post it on a special platform so that every Japanese person could see what was in their genome. So they started, so to speak, allocated funds, had the equipment, and began examining people, and accordingly started studying all of this. They examined the first 100,000 people and posted the results on this platform. And what did they find out? It turned out that, if I remember correctly, they started with the island of Hokkaido. And it turned out that among that first 100,000 Japanese people they examined, a fairly high percentage were found to have the sudden death gene. And what happened next? Then the number of suicides began to increase, because what is the sudden death gene? A person with this gene can live up to 100 years and it may never manifest itself. Or they could suddenly drop dead tomorrow and no one knows when it will happen or if it will happen at all. And what does knowing that a person has the sudden death gene actually give you? Anxiety, aside from this feeling of a sword hanging over your head, that at any moment you could drop dead, this knowledge gives you nothing else. After they saw a spike in suicides in that country, and they were already among the top in the world for suicide rates, they suspended the program and then treated it much more seriously and cautiously. Why, for example, was this Angelina Jolie phenomenon so criticized by geneticists all over the world? Because what she did was the wrong trajectory. She, knowing her medical history and seeing that she had something there, went ahead and removed everything before any clinical signs appeared. Well, as an oncologist, she removed her ovaries, and so what? So what? What are the chances she would have developed it completely in 5 or 10 years?
We never say 100%.
That's right. It might have shown up much later. That is, in fact, many people don't quite interpret the informativeness of genetic tests correctly. By identifying something, we can't always equate it with being able to immediately explain to you exactly how it will manifest in your particular case. Of course, there are diseases where genetic testing is needed to confirm an already developed illness, like some rare diseases where we can start treatment and so on. That's a completely different story, but doing this kind of analysis for everything and then realizing it's not actually for everything is really just misleading yourself.
Do you need to bring anything to the maternity hospital, or is everything provided so you can just show up and give birth? Well, let's say we're giving birth to a stone, right? A urological example. To get to the hospital with a stone, you probably don't need anything. You just need to get there. Are there maybe some specific things or maybe some advice you could give on what a woman should pack?
No, well, of course, there is a list of things for the woman, a list of things for the future baby, but relatives can bring things for the baby a little later. Actually, there are no problems here for the woman. For example, I remember the first time I went to the maternity hospital. I was a doctor after all. By that time, I had already graduated from my pediatric faculty and took this topic very seriously, so to speak. But my water broke at home and I realized it was time to go. What did I pack? I brought my knitting, thinking I'd have time to finish the sleeve. When I got to the maternity hospital, the admitting nurse smiled and asked, "Did you forget why you came here?" Half an hour later, I understood what she meant. So, of course, you bring some things for yourself, depending on the situation. For example, if they admit you, let's say, a week in advance for a scheduled delivery. When a woman knows that she will stay in the ward for 3, 4, or 5 more days, she takes a tracksuit, a nightgown, and so on. If it's already during the process, so to speak, when the water breaks, and it's clear that it's a matter of hours, then the list gets much shorter. Accordingly, everything needed for the postpartum period, I think the family or a loving husband can bring very quickly. In the next day,
I had a question. How do you know it's time to go to the maternity hospital? By the way, when my wife was giving birth, I was seeing patients at the clinic. She calls and says her water broke, and I was about to go, but I said I can't come yet. I still have 2 patients. They've been waiting for an appointment for 6 months. Are there any other signs besides water breaking?
no, obviously contractions are easy to identify and rarely confused with anything else. The only thing is, let's remind everyone once again, if all this happens at home and your water breaks at home, you must pay attention to whether it is clear.
Could you explain in more detail?
Yes, well, so to speak. They can be, for example, green with an unpleasant smell. That's bad. But if they are clear, almost colorless, or let's say a pale straw color, and if they don't really have any particular smell and there's enough of them, that's good. If they suddenly appear, it usually means everything is fine. Doctors will ask about this at the maternity hospital, so it's best to notice it early.
And if they are an unusual color, and you have a sterile urine container at home, for example, you don't need to collect them. Well,
it won't really give much information because it's already clear that the baby was suffering in the womb, since a healthy baby never releases anything into the amniotic fluid that could cause this effect. So if the amniotic fluid itself is green and has a bad smell, it means something was wrong and the doctors will have to take action right from the start.
home births, as people say, they always used to give birth somewhere in the field, standing there. I want to give birth at home. I have a friend, by the way, he helps me with production, and he had a home birth. This was actually in Argentina, I think, at home, but something didn't go quite right there, and it was really on the edge, so to speak. What do you think about home births? We usually expect everything to go smoothly at home. It seems to me that it's exactly in case of an emergency. There's that time it takes to call an ambulance and get you to the hospital. That time can be lost, because if something goes wrong in the hospital, help is always there within 5 minutes. Bleeding, help, shock, help. And what about your opinion? Let's say I haven't said anything, an unbiased opinion.
No, as a pediatrician, I believe childbirth should still be supervised by doctors. That is, of course, this is a very important moment, and it should be treated accordingly. All these unnecessary, careless approaches. Our grandmothers and great-grandmothers gave birth in the fields, as you say, and all that.
They immediately forgot everything.
Yes, that's absolutely right. Back then, they didn't just have 15 children for no reason, because at best, only 2 of them survived to adolescence. Infant and child mortality rates were high. That's why you shouldn't take things lightly and must do everything correctly. Of course, with the appropriate medical organization and of course under the supervision of doctors. The thing is, something can go wrong not only for a first-time mother. Many think, I've done this before, so why worry about a second time?
I gave birth so easily the first time.
Yes, very often the second or even third childbirth can be harder than the first very often. If, God forbid, something happens to the baby then, the chances they can help in time are almost non-existent.
To show them these aren't just words. Things could truly go wrong. What could happen if, say, she had her first child and then decided to have her second at home? What kind of situation could occur so that they understand it's impossible to handle it at home?
Yes, anything could happen, starting with bleeding, which neither the husband nor any woman who comes over and considers herself a big specialist would be able to handle. Or, God forbid, the baby is positioned incorrectly. We both know this can happen. Babies usually come out head first due to their position inside. But there are some especially talented families who think there's no need to go for checkups, that they know everything themselves. But what if, God forbid, the baby is breech and comes out feet or bottom first, then gets stuck? There's suffocation, everything can happen. There's no chance the baby will survive, because if the whole body and head don't come out in one push, the baby will suffocate and a contraction can pass very quickly. And none of these women who come here will be able to change that in any way, so there are a lot of risks here. And absolutely, when it comes to the life and death of your baby, you shouldn't take it lightly.
When we gave birth, I'm not even talking about being a hero. Nowadays, giving birth is nothing. They just give you a shot in the back, nothing hurts, everything is easy. In the end, they didn't have time to do anything. No spinal, no epidural. She gave birth with nothing. The doctor barely arrived from home in time that night, but as I understand, it's still painful. Giving birth is very painful, even with anesthesia.
Anesthesia doesn't eliminate pain, and what I'm about to say may be controversial. Anesthesia removes your emotional reaction to pain, so you still feel the pain, but you don't go into hysteria because it hurts. That's how I would put it. And a woman who, for example, has gone through it once with anesthesia understands what it's really like. Very often, the second time, she chooses to give birth naturally because she realizes that anesthesia is not the best option. When you close your eyes, open them, and your baby is brought to you on a silver platter, so to speak, you still experience pain. But it's just a little bit dulled, so to speak. But there are also other factors, starting with the fact that it can affect the baby. For example, it's a different type of anesthesia, not an epidural, and ending with the fact that many people after an epidural can have trouble feeling their lower limbs for several hours or even days. This also really scares women, and for some, it even causes their milk to dry up. So here too, it's a matter of weighing the pros and cons very carefully, to make your decision. I remember very well when I was giving birth to my second daughter, there was someone next to me in the neighboring room, so to speak. And the woman, oh my goodness, how she screamed, how she cursed her husband, what words she didn't call down upon his head. All the problems and horrors were hers alone, while he experienced nothing. After we finished, we lay next to each other in the hallway for a while. I asked her why she was screaming, and she replied, "Who, me?" I told her she was screaming, but she denied it. I insisted I saw her through the window. So sometimes people are in such an emotional state that they feel like they don't understand anything. And then later they say, "No, no way, that can't be." I said, "You were saying terrible things." When I repeated it, he asked, "Did I really scream?" I replied, "Yes, that was real distress."
And the husband? He's not home. He's a scoundrel and a womanizer. Sometimes, though, he joins for joint births with her.
That's very good.
I struggled to accept this idea, but my wife didn't ask for it either. But your attitude, what does it give?
Do you know, I think that a man perceives it completely differently. He worries about his beloved woman, and then he so tenderly and responsibly takes this little bundle in his arms. After all, he stays by the head until a certain moment, and then he usually leaves. And then, so to speak, they show him the result of this whole process. So, in fact, fortunately, he doesn't really see anything that terrible. But the emotional involvement in this process probably leaves a very strong impression. I can say that, for example, my eldest daughter and her husband became parents very early. They had their first daughter when they were 20 years old. And I was interested in my son-in-law's opinion, how he would handle all of this. Both times, they have 2 children now. He was present both times, and I saw tears in the eyes of this generally strong guy. And then I asked him, I said, "What exactly did you feel? Why were you in such a state?" He said, "Well, I see how my beloved woman is trying. She's in pain, she's doing her best, and I can't help her in any way. In other situations, I could do something, I don't know, fix something, take her somewhere, or do something else. But here I realize that I'm just a passive observer, and the only thing I can do is direct all my energy to help her." And so when they brought in the girl first and then my son, of course, it was honestly a completely different feeling. He takes his responsibility for these children very seriously. Fathers who've gone through this process generally do as well. It must be truly genuine involvement. You know, I've seen situations where a woman is giving birth and the father is in the next room with his friends. They've set the table and they're just sitting there drinking and having snacks. Partner-assisted childbirth isn't really about celebrating what's about to happen.
At our joint conference presentation, you said that you're not very fond of cesarean sections, especially when they're done without medical indications. Of course, sometimes there are medical reasons. Yes, of course, if the baby can't come out, if there's a very narrow pelvis or some other problems, that's different. But sometimes a woman comes in and says, I've watched a lot of movies, it's always painful, I don't want that, just do a C-section and take the baby out. Can you tell us what harm a C-section can cause, not to the mother, but to the baby?
Let's emphasize this again, just to be clear, so that obstetricians don't criticize us later. We're only talking about unnecessary C-sections, those done without medical indications. According to statistics, about 10% of births may require surgery, so about 1 in 10. The situation turns out in such a way that the woman needs help to deliver, so to speak, this burden. Accordingly, they make an incision in the abdomen and take the baby out. But this is unrelated to the situation you mentioned. Statistics show this has been true in every country since the early 2000s, say. The trend was that surgical births reached 30 to 40%, and in some countries 50%. In Turkey in the early 2000s, by around 2010, every second birth there was surgical solely because women requested it. Accordingly, when they realized this, they were shocked. Well, the Turks, of course, took a so-called remarkable approach. They banned surgical births. Well, how can you ban them if there are medical indications? So only for strict medical reasons. But actually, what risks does this pose for the baby? After all, once again, everything is thought out by nature and the Creator. So, by passing through the mother's natural birth canal, the baby receives a normal microbiota, and this normal microbiota, together with the fact that when the baby is born, they are immediately put to the breast, means the baby also comes into contact with the skin microbiota. It helps, meaning the microbes that live inside us and on us help the baby form what will become the foundation of their health. If this doesn't happen, if the baby is born in absolutely sterile conditions by means of a surgical incision, yes, meaning a small incision is made and the baby is taken out in sterile conditions, then the baby won't get this contact. A woman under anesthesia likely won't have her baby placed on her chest, so everything will be different. These babies often receive antibiotics, since mothers are prescribed them after surgery and the babies can get them through breast milk. This carries many risks, including physical and cognitive health issues, and may also lead to allergies. So this is a well-proven fact. Children born by cesarean section are significantly more likely to have allergies compared to those who were born naturally. And children who are not put to the breast within 60 minutes as recommended are significantly more likely to have allergies. Children who were not vaccinated within the first hour or the first few hours after birth also have a significantly higher chance of developing allergies.
And what if there is no milk?
It's not about the milk, it's about the microbiome, the microbes.
You still need to put the baby to the breast.
Yes, the very first hints of colostrum drops are just the beginning. It's a process. It's not like it's going to start flowing like a fountain right away.
So all these cases, like asthma being more common, that's also more common in those who were born by cesarean, right? A question about breasts. There's a lot of debate. Everyone thinks about beauty and wants to finish breastfeeding earlier. How long should you breastfeed and why? And why is breastfeeding so important for many people? I mean, I'm giving him the same calories and formula. So please explain, as the #1 specialist in your field, why breast milk is so important, how long you should breastfeed, and what happens to those who don't breastfeed their child.
Breast milk is not just a liquid, not some kind of super formula for feeding. It's living tissue, as they say now, living tissue that is produced by the mother specifically for her child. That is, each woman's milk is specially produced for her unique child. In addition to proteins, fats, and carbohydrates the baby needs, it also has other key components. There are also a lot of other important things like immunoglobulins, those very neurotrophic factors for brain development and so on. So in fact, it is priceless, and no formula, no matter what the manufacturers claim, can even come close to replacing breast milk. That's the first thing. Second, how long should you breastfeed? So we have a period, the first 6 months of life, when you definitely need to breastfeed. But there's one nuance. Between 4 and 6 months, we have what's called the tolerance window, When, along with breast milk, we start giving something else, like vegetable purees, cereals, or complementary foods, we begin to accustom the baby's body to accept something other than mother's milk. Accordingly, it's during this period that we need to establish this tolerance, meaning the ability to handle new foods. Schwannig, Schulzau, and Pieper will all have this window of tolerance. For us, it's from 4 to 6 months. So these first 6 months are the absolute minimum during which we should feed the baby, just the bare minimum. Ideally, this continues until the baby is 1 year old, since we introduce complementary foods from 4-6 months through 1 year. Gradually, each breastfeeding session will be replaced with some kind of complementary food, and by the time the baby turns 1, this will happen naturally. The mother will stop breastfeeding the baby because all the feedings will have been replaced with something else, and from that moment on, naturally, the value of breast milk changes. It is significantly less than when the baby was just born or when they were 4 months old. Why does the composition change, and why does the amount of all these essential nutrients decrease, and so on? Because the baby's body is already ready for the outside world, so to speak, for what they receive from it. Nowadays, it's common to hear stories of women breastfeeding not just up to 1 year, but up to 2 years, give or take, and I can still agree with that. For example, if the child's first year happened to fall at the beginning of summer, when there was a higher chance of infections, it was hot, and so on, then let's say the family went somewhere, that's also a time when you shouldn't stop breastfeeding, and so on. But still, anything after 2 years, you have to admit, is already, well, a big question mark. Why do some women breastfeed their children until they're 5? That's not normal anymore.
Postpartum depression. I used to think it was a myth, to be honest, until I experienced it myself.
And really, yes. Plus, you kind of become this source, so to speak, of endless production of this wonderful, amazing milk. By the way, with milk too, it's a very interesting fact. I think you notice it as well. At first, while lactation hasn't settled yet, things can be different, but then once the process is established, it's time to feed. It's like something is injected into the breast, meaning it fills up, the baby is put to the breast, and he sucks everything out, not a single drop is left. I mean, how precisely the body does all of this, how it organizes everything, it's just amazing. So accordingly, what are the methods of dealing with this? Well, actually, the love of your loved ones. Nothing helps postpartum depression better than the love of your loved ones.
Autism. Today you said, and I completely agree with you, that there is more of it now. And the question is, people just started calling it by its diagnosis more often. Before, they would just say, well, he's kind of strange, kind of unusual. So if that's true, why is it becoming more common?
On one hand, the definition has changed, meaning the classification has changed, and even the name has been changed now. It used to be called autism, but now it's autism spectrum disorder. So it's a group of disorders, and from the definition, it's clear that it's already several disorders. Naturally, there will be more of them simply because of the classification. On the other hand, the frequency is increasing. There isn't a single decent theory, not even a basic one, that explains this phenomenon. So people have tried to explain it with all sorts of different influences, but in reality, none of them have been confirmed. So it's clear that this is some kind of multiple influence, as a result of which the child's neurodevelopment is disrupted. But what exactly is primary remains unclear. Well, probably in the near future, medicine will be able to answer this question more definitively. What theories exist? Well, obviously, heredity plays a role, including some genetic diseases, as I already mentioned. By the way, there is also a theory, which might sound unexpected to many, that parents who are excessively into gadgets are more likely to have children with developmental issues.
Parents
Who are more often into gadgets, in other words, a lot excessively, are more likely to have children with autism spectrum disorder than those who do not have such excessive interests.
Can you explain more? This is interesting.
Well, this is just one of the theories that has revealed a reliable connection between the amount of time parents spend using gadgets and whether or not they have children with autism spectrum disorder.
So, does that mean it's because I spend less time with my child?
No, this actually forms even before the child is born. They are already born with this predisposition to what is called atypical neurodevelopment. Children like this are different from others from their first months, though it's not obvious at first. As a rule, this usually starts to be identified somewhere in the second half of the second year of life. After 18 months, it becomes more or less obvious to parents and others around the child. But if you carefully look into the medical history, usually these deviations start from the very first months. There is another interesting thing. Children with autism spectrum disorder have a completely different microbiome compared to healthy children. It is much, much poorer compared to what is found in typical healthy children. So there is a theory that, for example, by restoring the microbiome, you can restore or fight some kind of disease.
Then the tendency toward obesity goes away.
Yes, this progressive direction in medicine is called fecal transplantation. Exactly. That's why part of scientists' efforts are now focused on trying perhaps to change the microbiome of such patients to somehow bring them back or redirect the course of their development.
I was asking you out of personal interest for selfish reasons. How can I make sure my son is smart? Besides classical upbringing and education, how can I ensure that his intellect develops properly? And I said, maybe chess is necessary. And you told me something important. Talk to him as much as possible. Interact with him. Talk to him. And by the way, I actually started doing it more. It seemed to me that just by talking to him, I might make him speak faster or learn new words. But it turns out that this will affect how smart he will be when he grows up. And in the context of this theory, it turns out that we develop the brain for a long time. This is the window of importance when we should talk to him as much as possible. Babble, communicate, understand, not understand, it doesn't matter. Just give him this information. This period is very important.
Well, we've already touched on the topic of programming now. Formally, the health programming paradigm includes the period from conception to the end of the second year of life outside the womb. But as I already gave you as an example with folic acid and with other things, it's clear that this window opens earlier. Why should we start thinking about the baby? And as soon as we realize that he is already there, inside the mother, we start talking to him directly, not to the mother, but to him himself. Similarly, we continue after 2 years. Although there are studies that have proven that a child's cognitive abilities at the age of 2 fully correlate with what their cognitive abilities will be in early school age. So we already understand that
2 years old with
7 or 8 years, so we already understand how important it is. At the first stage, in the first or second year of life, to develop the child's brain, don't stay silent in the family or just stare at the television. You should communicate with your child. This opportunity doesn't end after the child's second year. Why are any intellectual games so beneficial for children? And actually, it's kind of an exaggeration to play puzzles on a tablet, but why do that if you can crawl on the floor together and put the puzzle together and even discuss something while doing it? So what am I getting at? Is it simpler to give a child a tablet even with an educational game on? But we understand that it's not just some random noises that the game makes. Usually there's something else going on there. We need to communicate with them because, of course, the number of words will also help their development, the number of words we say to them. So basically, the path to developing a child's intelligence is obvious. Talk to your child, engage with them, and they will develop well.
Well, we all know that if we look at modern moms out on the street with a stroller, most often the pose is like this: the left hand on the stroller and the right hand scrolling through shorts or reels. And it turns out that progress gives us a lot. Of course, but at the same time, the older generation, maybe I don't want to offend anyone right now, always says the previous generation was better and the current one is somehow weak. Everyone criticizes the future generation. But actually, we now have a reason to worry about this.
We do. Moreover, just recently, I can't remember which magazine, I read an article, actually a summary, where they measured the intelligence quotient of several generations, and it turns out that unfortunately modern children have lower scores. There was such a topic during the COVID-19 pandemic. They compared the development of 6-month-old babies born to mothers who had COVID-19 with those who were born before the pandemic. And they noted that there was some delay. Well, there were kind of mixed interpretations that maybe it was also related to various social factors. Due to lockdowns, many developmental activities couldn't take place. Although actually all developmental activities happen within the family, you don't necessarily have to go to any developmental centers. You can easily do this at home. But the fact remains, unfortunately, that digitalization definitely has some advantages if we're talking about the development of a child's brain. There have been studies showing a certain correlation between specific games and the development of certain cognitive functions, but this is a very narrow range. Meanwhile, for this small positive range, there is a much larger negative range. That is, excessive use of gadgets, including social networks, video content, and so on, greatly weakens cognitive activity, for example, in school-aged teenagers. To the point that those who spend too much time on this find it difficult even to retell something. They struggle to reproduce information, for example, when summarizing, or they have trouble solving basic math problems and so on. So, unfortunately, nowadays, parents really need to be very aware of what they want to see in their children in the future. So, if in general they don't really care and just let things take their own course, the process, they shouldn't be surprised if their child faces social failure soon. If they want results, they need to be involved.
We discussed vaccination during pregnancy. The child was born, and very often people message me on social media about being for or against vaccines. They ask for advice, but I don't want to give it because I always think that if I advise them to do it, they might go and do it, have some complication, and then blame me. If I say don't do it and they get sick with what the vaccine was for, they'll also say it's my fault. He said not to do it, so I don't get involved at all. Your opinion and why I care. Have we talked about this before? You often see mothers raising money for something, for rehabilitation, for treatment, and they show a video, look, the child was normal until 1 year old, and then, or until a year and a half. Then we got the vaccine, and now we have a sick child with cerebral palsy. How do you explain these situations, and are there any risks to vaccinating children?
There are many myths about vaccination, but today we can confidently say they are just myths. Believe me, over the years of my pediatric practice, I have seen a huge number of different cases that were supposedly consequences of vaccination, just like what we see now. But let's start with the fact that cerebral palsy is a pathology that develops in utero. It doesn't develop at 1.5 years old. It develops during pregnancy. These tracts that are damaged in their brain are damaged in utero, meaning the child already has them at birth. If we do a magnetic resonance imaging, we will see these disrupted neural pathways, which will eventually lead to these imperfect movements. That's why claims that a child was healthy, developed normally, and then suddenly got cerebral palsy at 1.5 aren't accurate. It's nothing more than an attempt to convince themselves. I've had more than one example like this, by the way, when a mother would say that her child was a victim of vaccination, but then when I finally convinced her to start his rehabilitation, to care for him properly and help him grow and so on. She saw the effect of this, she became more open, and eventually she gave us his medical records from birth. The child was born with an APGAR score of 0.4, meaning he was essentially dead. At 1 month old, he had a magnetic resonance imaging and his brain was just full of cysts. Yes. It was clear that from the very beginning he had very serious damage to his central nervous system. But his mother couldn't accept this idea, so the child just kept growing and growing. And then when he got the vaccination, she suddenly said, well, look, see the vaccination, look what it did to my child. So her whole world turned upside down, and now the vaccination was to blame, and somehow it became a little easier for her to accept the situation. Of course, it's a very philosophically complex issue. Children who are born sick when something goes wrong during pregnancy, when all the problems start right from birth, but sometimes they're not very noticeable. So, for example, a baby is born with a low APGAR score. Well, people think everything will be fine, or maybe the baby is very premature. Well, it's okay, now they've brought him up to 3.5 kilograms and now we're about to be discharged, so he's just like everyone else, but this is a premature baby who was born at 500 grams and has now reached 3.5 kilograms. His organs and systems remain unlike a healthy baby's. His lungs won't develop normal blood vessels and so on. That's why, unfortunately, children like this still can't be considered healthy by definition. And it's very difficult to accept that something is wrong with them, to correct it by addressing the reasons why the pregnancy didn't go as it should. It's much easier to blame it all on vaccination. Now, regarding the facts we know about vaccination, well, look, the longest study on vaccination has lasted over 40 years. That is, in the 1960s, the so-called Taxon study was started, in which several thousand children who were vaccinated at birth were observed. Back then, they vaccinated for smallpox, diphtheria, tetanus, and polio. And there were just as many who, for some reason, refused vaccination or were not vaccinated. They were monitored at the 7 and 42-year marks to see how often they developed conditions like allergies and asthma. It was shown that vaccinated people developed allergies and asthma less often than those who were not vaccinated. Many more similar examples could be given for a shorter time frame. So, coming back to the question of how dangerous vaccination is, well, it's not dangerous at all. Naturally, vaccination is meant to solve the problems caused by numerous infections. Believe me, I could tell you countless stories. One mother from a wealthy family lived outside the city and everything seemed perfect for them. And the older children weren't vaccinated because their parents believed living in fresh air, eating well, and affording fresh fruits and berries made vaccination unnecessary. They didn't deny themselves anything, so to speak. They went on vacations regularly and so on. The parents who grew up in the Soviet era were vaccinated against nearly everything. And then they decided to have a third child when the older ones had already become teenagers. And it just so happened that the mother wasn't vaccinated against measles. No, probably rubella. Yes, rubella. And she got rubella when she became pregnant for the third time. As a result, they had a seriously disabled child with congenital rubella syndrome, blind with a heart defect, a brain defect, and so on. And before that, when we talked with her, we discussed maybe coming up with a plan for vaccination for her children. She kept saying, no, we're fine, we don't need it. But when this child was born, well, she changed a lot, of course, and she started saying, oh my God, today I'm ready to shout from the rooftops, people, don't make the same mistake I did, listen to the doctors, get vaccinated. But it was already personal. For her family, it didn't change anything. Unfortunately, they already had this child with a very poor prognosis. So all these stories about some terrible cases, well, most often they turn out to be myths. It's either an undiagnosed, some rare disease that started, or, like in the case of cerebral palsy that I described to you, or something else related to a child's immunity.
We've already touched on this topic a bit, but you know, when a child is just born, there are even photos that shouldn't be posted. There's also, perhaps as a belief or custom, that you shouldn't bring many guests into the house or near the baby at first. So Leto, and why is that, editor?
Of course, babies are highly vulnerable to infections. Naturally, before inviting someone over, you need to think carefully. Could this person bring some unnecessary infection to your child along with their toys?
The reason I asked this question is because I saw an article in a video where a newborn baby was kissed and I think contracted the herpes virus. Editor. And this caused serious damage to the central nervous system and the child became disabled. Have you seen something like that?
There are various infections. I know the case you saw, but cocoon vaccination exists for a reason. to protect everyone the child visits, such as from whooping cough. Before a child receives the first whooping cough vaccine at 3 months and the follow-up doses at 4, 5, and 6 months, they are very vulnerable during those initial 3 months. For example, with whooping cough, what is whooping cough for a newborn? It's not just a very serious case of whooping cough. Coughing and episodes of stopped breathing can lead to death from respiratory arrest, brain hemorrhage, and as a result, scarring in the brain. Epilepsy, ruptured lungs up to pneumothorax, and many other very dangerous things. What about rotavirus? Gastroenteritis in infants causes permanent gastrointestinal issues. They're now discussing a direct link between early childhood rotavirus, gastroenteritis, and later diabetes. I can go on and on with this list. That's why when inviting guests into your home, you always want to ask why, what for what purpose. It's one thing when close people gather who have prepared for this birth and they all have the appropriate level of health. By the way, we shouldn't forget about tuberculosis because it's also very important to conduct the necessary tests to make sure no one has it. Unfortunately, there are still many diseases around us. Let the child grow up, let them start developing their own immunity after the vaccination series begins. Then, for heaven's sake, invite guests and have a great time.
On the other hand, some say the opposite, that if we worry too much about every illness, every infection, the child will actually grow up sick because of it, because it's normal to come into contact with some harmful bacteria. It's normal for children to crawl on dirty floors, and living in an overly sterile environment isn't ideal either. Is that correct?
Well, generally, yes. That's exactly why, when maternity hospitals became sterile, we lost that factor people remember from the old days when women used to give birth in the fields, so to speak, and right away they would put that thing, what was it called, churyu, yes, into the baby's mouth instead of the mother's breast, but actually on the other hand, or rather not quite. Naturally, natural microbes, the microbes from the environment, they help, of course, to form protection, that is immunity, but the level of their pathogenicity can vary. That is, the ones that will just kill the baby right away, and that would be the end of their immune system training. Is it really worth taking that risk? That's why we know a baby is born in a sterile environment. This is why vaccination is needed in the first hours, because it makes the immune system work in the right anti-infectious way, and then this is reinforced throughout the first year with various vaccinations. Basically, we are developing in the child the ability to be ready, for example, to attend kindergarten during early childhood. Yes, all children get sick. They're called snotty for a reason. They often have runny noses. This is a manifestation of their normal immune process, which is happening in order to develop and then protect them throughout their entire life. So until a child gets acquainted with these most common pathogens, they will keep catching one thing after another. The main point is that overall, the respiratory group includes 200 or 300 different viruses, most of which cause a runny nose and cough, but don't have a serious impact on health. We vaccinate against those infections that can actually kill the body. That is, for example, meningococcus, which, by the way, can affect someone completely in just a few hours. Viral bells ring as temperatures hit 3 degrees each year. Automobile, wool, gender, order, participation to conduct on history is an expensive thing. They told Yelena it was good. What is brought in the first 2 years of life directly correlates with cognitive development. Later, the methodology changes. But we always have to draw this dividing line. There is a dangerous and highly contagious infection that we prevent with vaccines. And then there are all these minor things like all those rhino and other viruses, which people do get, yes, of course, and we actually need them for the development of a normal immune system.
You are a very strong pediatric allergist, so tell us, what should we know about childhood allergies, as briefly as possible? I only have a couple of questions left. I won't keep you long. When it comes to allergies, who better to tell us than you? Should we be worried or not? Why do they occur? What should we do? And in what cases? Should we just stop giving them shrimp, or does something need treatment?
An allergy, translated from Greek as alas ergos, basically means only one thing, that this particular person, whether a child or an adult, has an excessive reaction to something that others don't react to. All around us, there are all sorts of things in the air. If it was spring, there would be pollen, there are dust mites, anything really, but we don't react to them. But if someone with allergies sat here, they'd start sneezing, coughing, and have watery eyes. By the way, there have also been major changes today in the approaches to diagnosing and treating allergies. Just yesterday, for example, it was believed that a pregnant woman definitely needed to be restricted from so-called obligatory allergens, like all that chocolate, citrus fruits, strawberries, fish, and so on, because that way her future child supposedly wouldn't develop allergies. Today, however, it's been shown that a more varied maternal diet actually lowers the risk of allergies. If the mother has allergies, we only remove foods she reacts to, which is the correct approach. A baby is born, his mother is breastfeeding, then she introduces some complementary foods and notices some rashes on the skin. Not all of these rashes are related to the food eaten. It could be a contact reaction, and many people don't think about that. So today, I'm just giving examples to explain that the approaches have changed a lot. Previously, children with atopic dermatitis were put on extremely strict diets, sometimes limited to just bread and water, trying to minimize the number of foods that could potentially be allergens for him or her and accordingly cause these skin changes. It was later scientifically proven to be pointless. That food allergies don't play a role there, but there is impaired skin barrier function, and if you treat the skin properly, then there's no need to follow a diet. Why am I giving these examples? Approaches to managing children with allergies have changed entirely over the past couple of decades. But many parents don't understand this and keep restricting their children's food. They keep their children on antihistamines for months and use other approaches that simply don't work anymore. On the other hand, for example, our National School of Pediatric Allergology has advocated for starting allergen-specific immunotherapy as early as possible. What is that? Well, for example, if the body reacts to pollen, it's very good to start getting it used to that pollen. Like in the Middle Ages, royal children were slowly exposed to poison. At first, they would dilute a single drop of poison in a barrel of water and give the infant a few drops each day, then 2 drops, and so on. So they would gradually increase the concentration. In the end, by the time they came of age, they could drink a cup of poison and not be poisoned at all. Allergen-specific immunotherapy works by initially introducing just a few molecules into the body. The dose is increased daily or weekly depending on the medication, and eventually the body starts receiving the amount it encounters in everyday life. For example, when the birch is blooming, or the alder, or when, for instance, house dust mites are multiplying. Accordingly, it stops reacting, and in this way it completely forgets what, for example, pollen allergy is. But there are also certain nuances here. Today's diagnostic methods are so precise that they not only allow us to identify which allergen is responsible, like pollen, but also to specify which particular component of this birch pollen, for example, is significant for this specific patient. Why is this important? Because different components have different predictions for the effectiveness of allergen-specific immunotherapy. And if for the so-called major components, allergen-specific immunotherapy is super effective, when after a year or two a person completely forgets about this allergy, unfortunately, if they have a minor component instead of a major one, then this long, expensive, and weeks-long therapy will be completely ineffective for them. Isn't it important to tell the patient right away what their treatment prospects are? Really interesting things. Not many people know that, for example, cat allergies can be treated by giving the cat special food. If you give the cat special food, the cat stops being allergenic, and the child can reduce the amount of, for example, anti-asthmatic medications. These are all achievements of allergology in recent years.
Interesting. About pacifiers, what's your opinion? Should we overuse them or should we take them away as early as possible? And do they cause any harm to the jaw? No, pacifiers can actually cause harm. They may affect jaw development or change the bite.
There are several effects, unnecessary or let's say negative, from using pacifiers. First of all, it really is a fixed incorrect bite. If the wrong types are used, there can be various psychological problems if they are not taken away in time. After all, there is a very narrow window during the first year of life when more or less this can be justified. Sometimes children as old as 2, 3, or even 5 still use them. And so to speak, they keep sucking on that pacifier, and sometimes they even have several pacifiers hanging on a string like this. It's clear this is a psychological issue caused by the child's parents.
And I saw a video where they say, look, like this, he's crying, he wants to eat, and this sound means he wants to go to the bathroom, and here he wants to sleep. And by the sound, well, they show it, and it really does seem similar. Is it possible to tell what a child wants by the sound of their crying?
Of course, this is the biggest misconception, that a baby cries only because they're hungry, and that's a mistake all young parents make. When a baby cries, people usually first offer the mother's breast, or if there's no milk, a bottle of formula, believing this will soothe the baby. In reality, there are many reasons why a baby might cry. They don't like being wet, they want attention, they're too hot or too cold. And when it comes to things like being cold, people usually respond to that. They touch the baby and say, oh, the nose is cold, the hands are cold, but actually a cold nose isn't a sign that the baby is cold. Young parents almost never pay attention to the fact that the baby might be too hot. But there's also a very simple test for this. You unwrap the baby and they immediately stop crying because they were just too hot and couldn't tell their parents.
The second to last question. The last one will be about the book. Yes, sudden infant death syndrome during sleep, especially what causes it.
It's a complex topic, well known to local pediatricians. If you open books from the late 19th or early 20th century, you'll also find mentions of sudden infant death. But everyone knows that only a very small group of cases are truly sudden, and for the majority there is some kind of cause. But for many decades, pediatricians have been saying that parents shouldn't put their child in bed with them because still every year a lot of children, in our country there is such a term, it happens when a mother, roughly speaking, just puts the child next to her to feed and sleep at the same time and ends up simply rolling over onto the child. The child dies from this. So if we look at the general recommendations on how to reduce the risk of sudden death, the recommendations are actually very simple. On the one hand, the crib should be set up very well, meaning there shouldn't be any unnecessary items in it. All those endless little cloths that people hang around the edges, or the countless soft toys they put in there for some reason, and so on. Simply put, these things can suffocate a baby. These are always recommendations for sensible breastfeeding and vaccination, because it's known that both of these factors protect against sudden death. And really, it's natural. You need to be especially careful in families where there have already been such episodes of sudden infant death, either in this family or among close relatives, because this could be a manifestation of some genetic disease, including those related to the way the heart functions. But believe me, the actual cases of sudden infant death are really very few. A cause is found for everyone else.
Today we're quickly going over the main points, especially those relevant to Russia. Yes? We've discussed those, but I still have many questions. I hope we can meet again to explore more specific topics. So thank you very much, and I'd like you to say the name of this wonderful book you gave me, which really is wonderful. I can also recommend it. And where can people find it?